Let's talk now about how to document your family history. We use the pedigree format when we meet with families who have a history of cancer. The pedigree format provides a graphic representation of the family. The advantages of the pedigree is that it's easy to construct. It can be updated on a regular basis. We can easily see the family size and how people are related to one another. Let me show you how quickly you can document your family history. Let's consider a woman who's been diagnosed with breast cancer. We use circles for females and squares for men. So we have a woman, and we'll put an arrow by her because she's the woman who's asking questions. She wants to know if her family has cancer running in the family or hereditary cancer. So let's say she was diagnosed with breast cancer at 32. And she has a brother, which we draw on the same line. And she has one sister. People listed below us are our children. So this woman has one son. And let's say he's 5 years of age. And her brother has 2 children, 2 girls. And her sister has 1 son. Now let's color in this woman who's had breast cancer just to designate that she's had cancer. This allows us to see different patterns in the family. Above us are our parents. Here's her mother, and here's her father. Let's say her mother's 80 years of age. And her mother has 2 brothers. One who has a daughter. This is this woman's maternal first cousin. And the other brother has 2 sons. Again, maternal first cousins to the woman seeking information. And none of these individuals have cancer. You could add their ages. Perhaps one is 75 and the other 71. You could go up another generation. Maybe her mother, this woman's maternal grandmother, is deceased, and she died at 54 from heart disease. And her maternal grandfather is also passed away, and he died of natural causes. Now let's think about her father's side of the family. Her father's living, and he was diagnosed with a brain tumor when he was in his 40s. She doesn't know the exact age, but she knows it's in his 40s. And he's now 81. And he has 2 brothers and 2 sisters. Again, reference to the family history is always based upon the person seeking information. So this woman here. So these individuals represent her paternal aunts and uncles. And let's say one uncle was diagnosed with colon cancer at 38, and then he developed lymphoma at 65, and he's still living at 77. And he has a daughter. Again, this person is this individual's paternal first cousin. Let's say her sister, her father's sister, has no cancer, and she had a son who had leukemia at a young age. let's say 4 years of age. Another sister has a son and daughter. And the brother has a daughter diagnosed with breast cancer at 28 years of age. And he himself has passed away. He died with pancreatic cancer. And he died when he was in his 60s. And the woman's father's parents are deceased. His mother had breast cancer. When she was 41. And his father died at 85, again from natural causes. So we've quickly drawn out both sides of the family. We've used circles for women and squares for men. Let's look at this family. We can see the family size. We know immediately how many people are closely related to one another. We can also see the pattern of cancer in this family. When you're speaking with your relatives about your family history, and in particular your family cancer history, don't forget to ask about what type of cancer they were diagnosed with. About what age did that cancer form, or were they diagnosed with? You can imagine that having a mother diagnosed with breast cancer in her 20s is more significant than having a mother diagnosed with breast cancer in her 80s. It confers a greater risk. So that information can be very helpful. Sometimes relatives will say, well, he had a liver cancer, and he died from a liver cancer. But in fact, that cancer didn't start in the liver. It may have started somewhere else in the body and spread to the liver. We need to know for our risk assessment for your family where that cancer started. Ask if other family members have other chronic health concerns, or did they have health problems when they were born, or have birth defects. Also ask about exposure histories, such as exposure to tobacco, or did that person smoke over a period of time? And don't forget now to ask about genetic testing. Did someone in the family have genetic testing? What specifically were they tested for, and do they know the results? In looking at this family, you can see it's very clear to see the pattern. There's no family history on her mother's side, but her father's side tells a very different story. We see the features of hereditary cancer, and even though the cancer types are different in this family, the pattern is very clear. We see many of the features of hereditary cancer. There are multiple people who are affected. They are in multiple generations. We have people who are diagnosed at a young age, like this woman who presented at 32, and her cousin and another cousin with leukemia at age 4. We have people in the family who have more than one type of cancer. Colon cancer did not spread or turn into a lymphoma. This uncle had 2 different types of cancers in his lifetime. Other features that we look for are an unusual presentation of cancer. Consider a man who's been diagnosed with breast cancer. Certainly men can develop breast cancer, but it's not as common as what we see in women. There are certain ethnic groups in which gene mutations occur more commonly and are associated with certain types of cancers. There's not one person in this family who makes a diagnosis of hereditary cancer. It is the totality of the family history and looking at this entire pattern that we see hereditary cancer in this family.